Right, okay. Hello to everyone, and this is one of the free sessions from Way to Paces. I'm Dr. Ramesh. So, if you look at this scenario, you are the doctor in the medical ward. 75-year-old Jennifer Thomas was admitted to hospital with epistaxis, secondary to a tumor in the nasopharynx. She was on aspirin, which was stopped. There were two patients with the same name, and the Clexane, which is enoxaparin, 120 milligrams, was given wrongly to her instead of other patient. She developed severe epistaxis and needed nasal pack. Her son, Joseph Thomas, wants to discuss about the nosebleed and further management. Task: talk to Joseph and answer his concerns. So this one scenario, like part of the discussion, the first thing is we need to find out in terms of what the theme is, and then what are the emotions involved here, and then we need to form a structure and go step by step. So this one, you can easily see, the reason I'm telling all these things is we need to make use of the 5 minutes before the scenario and then note down all the important points so that we can see how things go and get a good preparation. Not only before the exam, whenever you're doing a role play with your study partners, if you can do this, you get into the basic very strong and do all the practice very well. So let's say, without going into details, people can say, oh, there's something error happened. So enoxaparin was given to this patient, Jennifer Thomas, instead of other patient. It's a medical error. And we need to speak, the task is we need to speak with their son about the medical error. So this is the theme here. And how do you structure? The first of all, as with all the station 4, first is introduction. And then try to have a good rapport. Because I said first have a rapport, and then I change it to try to have a good rapport. The reason for that is, in straightforward situations, it's easy to get the rapport. But in difficult situations, like where the emotions are high up in anxiety or particularly anger, it's a little bit tricky to get the to get the rapport at the first initial consultation. Because when people are angry, they might burst the anger even from the beginning. So that's how it can be there. So the main emotions here we can come across is anger, and then upset because of the complication developed as epistaxis due to the Clexane. And the third thing was what is going to happen, because she's already having a cancer and tumor, and what is going to happen. So these are all the things we need to look for in this situation. When we go back to the structure, there are two things. One is what we are going to tell the patient, and second thing is what the patient or the family, what they're going to ask us. Information giving and information gathering or reassuring, everything else. So in this scenario, I think few people joined now. I've just texted the scenario again in the chat. For new people, the scenario is you are the doctor in the medical ward. 75-year-old Jennifer Thomas was admitted to hospital with epistaxis, secondary to tumor in the nasopharynx. She was on aspirin, which was stopped. There were two patients with the same name, and the Clexane, which is enoxaparin 120 milligrams, was given wrongly to her. She developed a severe epistaxis and needed nasal pack. Her son Joseph Thomas wants to discuss about her nosebleed and further management. Task: talk to Joseph and answer his queries. So we're just summing up. Get the theme first of all, medical error, and then what are the emotions involved. Mainly here, you can expect the family or Joseph to be angry. And structure-wise, information giving and information gathering, or in the scenario like station 4, rather than information gathering, and it's mainly in terms of like reassurance and then support them depending upon their emotional distress. So first thing, rapport. How to start the conversation? Anyone want to tell? Anyone? How do you start the conversation here? Okay, as with any scenarios, the first is introduction. So we have to tell our name, and then where in this case, let's say I'm Dr. Ramesh, I'm in the medical ward, and I'm looking after your mother, Mrs. Jennifer Thomas, and can I check, are you Mr. Joseph Thomas? And then the next question would be, how do you like to be called? Again, whether it's a patient or a family member, that's where the little bit of rapport starts. Obviously, they can say Joseph, or you can say Joe, anything like that. In a straightforward, less emotional situations, for example, taking the consent of the procedure or explaining about a chronic medical condition, people can gel in quickly into our consultation and can start the conversation. But particularly where emotions were at peak, like anxiety, anger, and different things, it's very difficult to gel initially. But we don't need to worry about it. But when things go on with the conversation, we can build it up. So still, the introduction holds the same. Name, purpose of the visit, checking the other person's name, and then if the patient or the family, we have to ask, what would you like to be called? And then if the person says Joe, yes, Joe. Sometimes people say Mr. Thomas, and then you can say Mrs. Thomas. That's the way it is. Then how do you start the conversation? Because the key thing here is you have to tell that something wrong happened. And before us telling, as we say in all the communication skill stations, you need to ask in terms of, because it says Thomas wants to discuss about nosebleed. So what is this? What is he thinking? And you can say either way. You can straight away start in terms of, hello Joe. So we are here to discuss about your mother. And before I tell you something, what do you know about her? That's checking the understanding. That's a key point, because it doesn't matter how angry people are, how anxious people are. We have to go step by step. If we miss one step, and that's where the tough things will happen and things will go pear-shaped at the end. It's very difficult to get it back to the mode. So the third step is in terms of checking their understanding, why they are here and what is the situation is about. And in this case, he will definitely tell in terms of, okay, anything. He will tell he was very upset about, and straight away he can be very angry and then say, that's horrible to know my mom's had a nosebleed. That's horrible. She came for nosebleed and there's still a nosebleed is there. I don't know what's going on. Can you please tell me what's going on and where we are at? That might be the usual question or the query here, because it says he wants to discuss about the nosebleed and further management. We don't know whether he might know about the incident already. One of the nurses could have called, and then he might be coming with the full anger to say, one of the nurses told me that she had a big deal. Tell me what it is and why it is. It was very controlled, very well controlled last time, and now what happened? That can be there. Or even he doesn't know anything about it, no calls, nothing. This is the first time, just incidentally, he used to visit his mom around 3 o'clock. He just come in, and then he can say, no, I've come here to see my mom. And he can say she's having something like a pack in her nose. I don't know what's going on. And can you please explain me? So any different directions it can go. Whatever directions it can go, our job is to make sure we are asking the family their understanding where they are at. Depending upon their understanding, we need to take them to the next set of conversations. Let's say if they already know about the nurse called and then she had a bleeding, and you can tell because the initial thinking would be she had, and the epistaxis was the nasopharynx, and you would be thinking in terms of what are the treatment options, where it is, and then where do we go from here. That's what he would be asking if he doesn't know about the error. But if he knows about the error, the straightforward question would be, why did he do that? What happened? You all know she wouldn't give. Already she's bleeding. Why the bleeding? And then the questions will be at the high peak of emotions, and then we need to tackle all those things. So now the question is, see, when Joe doesn't know anything about it, the conversation part is a slightly different. And when Joe knows about it, it's slightly different. When Joe doesn't know about it, there comes a warning shot. And it is like a breaking bad news. That's the key here. Yes, error and error plus the breaking bad news. The medical error comes under breaking bad news as well slightly, because you're going to tell something bad, and they may take differently, and they may react differently, they may respond differently. So now the next step is, let's say he doesn't know anything about it, you check their understanding, and then initially we need to give a warning shot. How do you give a warning shot in this case? Anyone? What warning shot do you give here to Joseph, his son, about what happened? Yep, you can straight away say there are different ways to give warning shot. See, warning shot is straight away, you can say, I'm sorry to say that she had a bleeding, and I'm going to tell the reason behind this. So I'll explain what happened. You can say that. So you can say the bleeding happened, something wrong happened there. Or you can say, in terms of unfortunately, there was an error happened in your mom's medication, and I'm so sorry. I want to explain what happened. See, the moment we say error, then the emotional level, anger level will go high. So we need to be ready for that. So we can't say simply, don't expect to say, okay, oh yes, doctor, tell me, come on, what was the error? I want to know more about it. Nobody will ask. The moment we say error, be ready for the blow, which is coming back from the family, particularly in this case, Joseph. So that's where the warning shot, all the warning shot is like that. It's a warning shot in terms of, let's say, the bad news, diagnosis of cancer, and then not anymore for chemotherapy, not for radiotherapy. I'm not going to give fluids. I'm not going to do the resuscitation. That means the CPR. So that reaction is different. But in these situations, the reaction will be completely different. So expect the blow with high emotions, particularly anger, when we say error. That's why I wanted to tell you all, be ready to get the blow and then how to tackle it. The next thing is, okay, you're told that's an error, and then big blow will come. What error? That is not acceptable, and it's not right, everything. And you have to tell the same thing. Yes, I agree with you. This shouldn't have happened. I honestly agree with you, and not only your mom, for anyone, this shouldn't have happened. But unfortunately, this happened. And then the question will come, what happened? Then you have to disclose in terms of there were two patients in the ward with a similar name, and one of them is your mom. Or rather than telling mom, you can say mother, because it's an exam, not try to avoid mom, dad, and abbreviation in that. And then you can say in terms of, instead of giving the injection to the other patient, unfortunately we had given to your mother. And the injection was Clexane or enoxaparin. It's a blood thinning medication. And again here, once you say blood thinning medication, here the actors or the surrogates are well primed to know about medicines and things. Once we say Clexane or blood thinning medication or enoxaparin, and again another big blow will come, emotions. Okay, you shouldn't have done that. It's already bleeding. How can you do that? This, that, everything will come. And there's a clue is also there in the scenario. Aspirin was stopped. So for people who have joined new, I've just sent the scenario in the chat again. Then you have to explain, and people can say in terms of, see, we stopped aspirin because of the bleeding and you're just giving blood thinning medication and making the bleeding worse. Yes, you will get a big blow. First time when you say error, get it back. Second time when you mentioned about particularly the drug blood thinning medication. And people know. If people didn't know, then it won't solve the problem. You will get a blow again. Another way you say in terms of, okay, Clexane or blood thinning medication, and immediately say it causes bleeding as an unfortunate thing. So how do we tackle? So these are all like a step by step. Getting the rapport, explaining the situation, check the understanding first, and then who we are, why we are here, warning shot, first thing about the error, two, second warning shot, and what is an error and what caused it. So again, the big blow is in terms of emotions, anger is there. The next step would be what Joseph can ask. So who, anyone want to tell what Joseph can ask in this situation?
How can you do
Who did
this
it?
to my mother?
That's a commonest question. Who did it? Tell me, who did it? Did you do it? Did your friend do it? You know very well and you're not telling me. Then how to reply to that? I don't think we shouldn't, not I don't think we shouldn't disclose anything to them. Like you can't say, my friend so-and-so, yeah, he's in the next ward. It's not me, but my friend did it. He's the one. And then you can't explain everything in terms of, okay, my friend was very stressful on that day and he had got so many problems, he was not well, that's why by mistake it had been done. These are all completely unnecessary. So the incident is between the team and then no need to disclose anything to the patient or the family. So we are going to tell, yes, we are not going to tell anything. That's the thing actually. Unfortunately, I can't say, see the scenario didn't say, you know who the person who did the error, unless it's you. That's a different thing. If the scenario says you have done an error, you can honestly say, I'm so sorry to say, I apologize. I was the one who was involved in the error. You can say that, but I don't think it will come in the exam. But if someone else had done it, if it does not come in the scenario, no need to go there, and you can keep silence. Unfortunately, I'm not aware, and people will say immediately, you know, you're hiding it, you're saving, you're hiding, and then saving your friend. It's not like that, but you can say, that's the case is, I'm not telling, it's not, I know something, I'm not telling you, I don't know. And then he will ask, the patient will ask in terms of why this happened. There's no system here, and the NHS and all the media things will come. I know NHS is always like that, busy. You people didn't even say that. How can you give it? How is it possible? I can't think of it. So anything can come up. So the answer is be quiet and then repeatedly say, yes, I can imagine how hard it is to you. I agree with you 100%. It shouldn't have happened, but unfortunately it happened. And then stop there. See, what we shouldn't do at the beginning is try to reassure them at the end, but not at the beginning. When I say reassure, so in this case, nasal pack has been done. So we can't, that's one of the point to get it across, to say, yes, it's an error. Yes, it shouldn't have happened, but it happened unfortunately. But we didn't have any major complication. That's what we usually tend to say. We can say that, but don't say in the beginning. And then that's not going to help at all. It is just like the last time we discussed about like corneal donation or the organ donation. So don't say in front of corneal donation is helping other people. You know, she wanted to help and we all wanted to help. And that may be the valid reason, like a 1 out of 10, but not on the top. Likewise here, we shouldn't say that nothing happened, so it's all settled now and she's fine. We have to give some time. We have to say this to reassure, but we have to give some time and then say this. Always step by step. So accept the mistake or the error. No need to tell, or the scenario doesn't say we are not going to tell who the person is and what happened, when happened, and all. And at the end, we can reassure in terms of this is what happened. Then the question will come in this scenario, particularly, okay, the bleeding happened. So the bleeding is due to the medication I've given, and then I was thinking in terms of tumor getting worse. Thank God it's not getting worse. Then we can't always exclude. We can say yes, this point of time, the medication is the reason for the bleeding, but unfortunately we can't exclude the tumor getting worse if we know all these things in the scenario. But in this scenario, it's not there, so no need to go there. You can simply say yes, apologize. We'll be extremely careful and think. The next section is you have told the error, apologized, reassured that there isn't any, she's not suffering and she's not having any problems with this due to the epistaxis. She's not having any problems at this point of time with the nasal package. Settle everything over. The next step is how do we prevent happening in future, and that is the only thing we need to reassure over there. And before that step, complaint. So do we take this as a complaint, or do you ask Joe to make a formal complaint? Again, it depends on what people tell and how their conversation goes. Say if the people are asking in terms of, no, I want to do a proper complaint, where do I go? And again, we all know we need to put them in the proper direction, like a pulse, or we ourselves can take it as a complaint, and then we can say, I will let my seniors or the consultant know about this, and one of the team will be in contact with you. So we need to investigate what happened, and then they will tell their reply in terms of this is what happened, and I'm so sorry, I apologize over there. So it can stop at the verbal level with the conversation. It can move on to the complaint level, like a formal complaint level. We need to make sure what is the option available and what are the preferences. The last step in terms of what do we do with it. We get a complaint. What do? We take a complaint and we will sign into the system. It differs from hospital to hospital, what we call incident reporting. So any incident, when it happens, we have to report it, and then that will be taken care of. There will be a team of people sitting and discussing. They will be investigating. When I say investigating, they will look at the notes, and then they look at the error, what happened. They will discuss with the person or persons who are involved in the error, and they need to tell what happened, when, why, possible explanations, and they need to reflect on, okay, this happened this time, and how do you avoid next time, anything over there. And after the reflection, everything, they will go back to the family and then write it back to say, this is what happened, I apologize, and then we made it clear so that it won't happen again, and we disseminated the information over there. What did we do to avoid errors happening? And that's again two problems. One, if there is a system related problem, create a system to avoid errors. If it's a people related problem, training and education for the people. Those are the two broad things to look for in medical error. One, if there is a system related problem, correct the system or change the system or modify the system. If there is a person related problem, training, education, and make the person well known to have all those facts and then all those information, so that next time he or she won't be doing the same thing. So that's what I would say, the whole scenario approach, and see step by step what is happening, what to do, and things. So any questions from now, or any of people wanted to do anything different in this situation? Any questions?
Sir, full form for pulse.
I'll check the chat. You can even chat. Either you can talk or do a chat if you have any questions. Pulse, yes. And in the chat, Dr. Arulmoli asked about pulse. Yes, we need to refer. If the patient is, in this case, is Joe. If Joe wanted to do a complaint, you need to direct them to the pulse. But the one checkpoint is, it's not like we don't take anything in the mind. Okay, it's not like routing them or diverting them. So you can also have the information. We can also make it known to the seniors. We will also deal with it. At the same time, there is a team of people called PALs who can help with you to make a complaint formally. And if you are, I can give you them contact numbers, and you can say, you can't say the contact numbers and all in the exam, but you can say, I will provide you the contact numbers and things. So you can go and meet with them, and they will support you and guide you how to make a formal complaint. You can say that. Right? Any other questions? What is that? Full form of PALS. Anyone else? Anyone want to tell? Full form of PALS. Patient Advice and Liaison Service. Patient Advice and Liaison Service. So they are there to advise the patients, and then like a bridge between the team, the NHS, the ward, or anywhere else, the whole hospital team, and the patients. So they support. It's like an advocating for the patients and families. Right. Any other questions? Okay. So when you practice, like we said in the last session, first of all, get the theme, and then think about the emotions involved, information giving, what you need to tell step by step. Is it a breaking bad news? If there is a breaking bad news, you have to give the warning shot. Then information gathering in this situation, like reassuring and telling the same thing again in terms of apologizing. And where do we go from here? Can they make a complaint? If they want to, where, how? And the next thing is in terms of incident, how do we report it? How do we prevent this happening in near future? And if they talk about how we're going to correct it, the simplest form, if the examiner asks, so what do you do in the meeting and how do you correct it? Then you can say, I'll analyze, the team will analyze, and then the team will look into whether there's a problem in the system. If there is a problem in the system, they will change the system. If there is a problem in the person, with the system being all right, and the person needs to be trained, and we have to educate the person. Anything else before we conclude the session? Any questions in this scenario? Right? I'll take it as no questions. And I would suggest you all to look into the themes, and then while you do the practice, and take it from there. I'll suggest not to jump into straightaway scenarios. You can do it, but you'll easily forget about what you have done and what you needed to learn and things. But if you go methodically, step by step, you know where you stand. When you do the first scenario and go with this, and when you do the second scenario, you will know the difference, what I have done, what I have not done over there. So people who are new to Way to Paces, we do have a YouTube channel called Way to Paces, and then Facebook page, Twitter, Instagram, and we do have a WhatsApp group. I'm not sure if anyone is new or not aware of the WhatsApp group. You are always welcome to join the WhatsApp group. If anyone not aware, let me know. I can give my number. You can contact me and have a go through with the videos in the website. We have a website, www.waytopaces.com, and also they are in the YouTube channel and Facebook, and it's everywhere. Lots of free videos on different topics there, including how to approach different situations, how to approach different scenarios, and also lots of like role play sessions. So have a look at those videos. Anything, give me a shout. I will share my number here for people who don't know. Right, you can WhatsApp me if you want anything in terms of doubts or anything like that. But if people want to do like a one-to-one session, again, you can contact me and we will take it from there. I've just seen a doctor joined. I'm so sorry, we've just completed this session. So anything, give me a shout and then note my number to contact and we'll take it from there. Best wishes. Thank you. Bye-bye.